All right, everybody, welcome back to the podcast. Appreciate you tuning in today. Today, we're going to get into something that's a condition, diagnosis, syndrome that's been tossed around my entire career when I was first in practice. It came out as a sort of a newer diagnosis, a newer idea. Still, probably in the symptom, or I'm sorry, the syndrome category. It's fibromyalgia. Okay, now it's a condition most of us have heard about. A few people are mystified by. In the beginning, the medical community was very standoffish about it. They said it really didn't make any sense. And then they slowly came to grips with the idea that a lot of people are having this condition. There's a series of symptoms. And like any disease, when it's first discovered or first recognized, you got to figure out a reasonable explanation, definition, and series of symptoms to then put it in that watertight container that Western medicine calls a diagnosis. And if you've tuned into some of the podcasts that we've done in the past, I like to differentiate the differences between Eastern and Western medicine, because they're both wonderful things. They're both life-saving. Thank God for both of them. But it's good to understand where one shines and where the other one doesn't, when to use which one. I have so many patients that will talk all the time about looking for a more holistic medical doctor. And I don't really, promote that heavily. I'm like, let your medical doctor do his thing. Be an educated consumer, have another holistic doctor or natural doctor of some type, a naturopathic doctor, a chiropractor, somebody who's versed in Eastern medicine or acupuncture. So you have both sides. You have, an educated person can figure out when to use which one. You don't go to your acupuncturist with a heart attack, obviously. So we want to be reasonable about how we use them and get good definitions and understandings of who does what really well. And if you hang around these people, you'll know. They'll be able to tell you. I tell my patients every day what I treat and what I don't. And I refer all the time out to practitioners who have an expertise in whatever condition this patient has. And oftentimes I work in concert afterwards. Some of the more horrific conditions, a person's going to go and have the medical establishment do the drugs and surgery and chemo and radiation and all the stuff. And I'm going to be there, maybe in a smaller way, but still in a way that's going to aid them to make them improve as well, coaching them on diet and all the other stuff. But I had someone recently ask me about fibromyalgia, my friend Karen, and I wanted to do this, sort of dedicate this to her and to all the people out there that are suffering with this for years, and all the, sort of lack of recognition that it's suffered and where it is now, because it's sort of like, it kind of went into the woodwork again a little bit. And I think it should be back out there. So I want to get some recognition for it. When I looked up some of the incidents of this, because I have it in my practice, many patients with fibromyalgia, they'll come in and say they have back pain, this and that, and then say, well, I've also been diagnosed with fibromyalgia. And it's good to know that, because that is a collection of symptoms that make you pretty miserable. The first thing I thought was interesting, and I knew this from my own personal experience, that it's almost exclusively found in women. There are men with fibromyalgia, but it's an overwhelming number found in women. So you wonder, what is the correlation with female physiology in this? And that's still a little bit unknown. But 1 in 20 people have been diagnosed with it. It strikes women mainly between the ages of 20 and 55. And I think I found that as well. And as I went through my first practice with this, when I started having patients with fibromyalgia come in, one of the most obvious things I noticed is none of them are sleeping properly. And it became a chicken and egg question. Is the lack of sleep leading to a slowed breakdown or slowed repair, and the daily breakdown was not made up by the sleeping process repairing? Or was it the other way around, that the condition was causing the sleep disturbance? And I found more commonly that the sleep disturbance was number one. The first thing they were doing was having alterations in their life due to lack of sleep. So a person would oftentimes have a back injury first, and then years of dealing with the back injury, the medications, maybe the surgeries, and they weren't sleeping because the drugs weren't allowing them to get quality sleep. Their back pain wasn't allowing them to get quality sleep. And before you know it, what started as back pain now is multiple joint trigger points in the muscles, pain throughout the body, mood disorders, all kinds of situations that were just terrible. And then to resolve that, what should a person do? So let's get into that a little bit, but understand the difference. I like to diagnose things, but as well talk about them as if they're imbalances, because a diagnosis is kind of a watertight container. It makes it's a great idea because it helps us study something as this condition, call it something and study it. But as you know, many people are diagnosed and have varying symptoms in many conditions. So Let's start out with a little bit of a definition. So fibromyalgia, best defined as a disorder characterized by widespread musculoskeletal, so muscles and bones, pain and fatigue, sleep disorders, memory issues, emotional and mood disorders. Uh, Body dysmorphia seems to be associated with it. And when they've done some blood work on these people, they found low serotonin. And if you remember from any podcasts in the past or what your own studies, low serotonin is a miserable thing. If you have low serotonin, you will be depressed. You'll be less successful in life. You have less energy to take on challenges. You're easily defeated. And serotonin is associated with some of it's genetic. It's made in the brain. It's also made in the gut. And the healthier the gut is, the more serotonin you make. So you can tell I'm going to get into diet on this like I normally do. Basic questions I've seen. Is it an autoimmune disease? And it's a great question because it has a lot of characters like an autoimmune disease, but it is not. It is not diagnosed or considered an autoimmune disease. But fibromyalgia over time has been shown to weaken the immune system. So you end up with a weaker immune system, which is, part of the imbalance of autoimmune diseases. It's too weak or too strong, an immune system out of balance, attacking itself. So it's associated, so you can see that. Does diet matter? And we're going to get into that, like I said a second ago, and the answer is absolutely yes. It is very much a dietary related condition. Is gut health related? The answer to that also is yes, not just for the serotonin manufacturing, but also for some of the studies that show that there's cognitive disorders. Now, this fibromyalgia is first diagnosed or considered a diagnosis in 1987. And when I was first in practice in the early 90s, I realized that it was sort of the latest condition that people were using to describe their muscular imbalances, their muscular pain, which was great because they had a new tool. But first thing to get into, let's talk about some of the treatments, because to treat fibromyalgia it's been a crazy ride for people. I've seen all the different diets, all the different supplements. Supplement companies have got on board and made all kinds of nutrient formulas to try to get together and say, okay, these are malic acid, I remember, as a treatment, and supplements. But the truth is that diet is crucial to this. We're going to get into how the body work, whether it be chiropractic, yoga, into that as well. But like I said a minute ago, we want to make our serotonin high first off, because serotonin is going to give you energy to heal. It's also going to get you in a better mood, so you have more energy to do things and think more clearly. It's associated with decision making. And one of the things fibromyalgic patients have is they have a hard time making simple decisions oftentimes, and having a hard time with follow through and impulsivity control, which is interesting. And people tend to be probably so fatigued. I mean, who isn't cranky and impulsive when they're fatigued? So it might be associated with that. But we want to make sure we're getting enough tryptophan. If you remember tryptophan, people talk about turkey and Thanksgiving and getting sleepy after eating a lot of turkey. And it is found in turkey. It's found in tuna, oats, nuts, and seeds. And it's an important food found in the healthier foods. And one of the things that decreases your ability to make tryptophan, which then makes serotonin, are carbohydrates. A very negative effect. Carbohydrates are destructive to tryptophan and then to the production of serotonin. And we make serotonin, like I said earlier, in the brain. We also make it in the gut, right? So we want a healthy gut to make sure that we're able to produce this stuff. Now, some of the other dietary things we've looked at, they went into the vegan diet. And they said, is this a big deal? And with the vegan, you're not eating any meat or dairy products. And they found out that although it's a great diet, it didn't make a big difference in the body pain, but it did help with mood improvement, which was interesting. So they were asking these fibromyalgic patients multiple questions. And one of the things they found out was that they felt better. So it, once again, probably got into that serotonin tryptophan axis and helped with gut health, but it didn't necessarily change the body pain as much. The next was the Mediterranean diet. And they thought, okay, let's look at that. And I've mentioned that in the last podcast about its effect globally on menopause, and it had a very positive effect for menopausal women. But in this study, they found once again another very positive effect, and they in a big study they saw a decrease in depression, anxiety, and fatigue. So it really got in more to the mental as well. And the other diet they looked at was what's called the FODMAP diet. It's an acronym. You can look it up. FODMAP, FODMAP. And that's a diet that has it's a more interesting diet to me because it seems to eliminate foods I classically think are healthy, and that always sparks my interest because I love learning. And this one, you're not allowed any dairy, any cereals, any grains, with the exception of rice. No cashews, and the fruit is very limited. You're allowed strawberries, kiwi, banana, citrus fruits, and pineapple. So those are allowed. All the other fruits are not. And then when you get into vegetables, you strip off a lot of vegetables. The only ones you're allowed are tomatoes, which is pretty shocking because that has a lot of inflammatory components. But in this one, you're allowed tomatoes, lettuce, carrots, cucumbers, cabbage, and pumpkin. So it's pretty amazing that you can have really be selective with certain ones, but that one has been shown to have a pretty big effect. And it really helped with irritable bowel syndrome. That's where the FODMAP diet, I think, classically started. I've seen it used for learning disabilities in children, as well as irritable bowel syndrome. But the FODMAP diet is designed to, work with the improper fermentation of food in the gut and some of the detriments of that. So the irritable bowel syndrome was, a big part of fibromyalgia, like we said earlier. The other diet that I looked at was the hypokalemic, hypo meaning less calories. So it's a diet of 1,200 calories per day. And they specifically break it into 20 grams of protein, or 20% protein, 50% carbs, and 30% fats. And we've had some people on the podcast in the past that did the macros diet, Trish Williamson. And that's a macro breakdown, right? Because you're looking at percentages of the big macronutrients, protein, carbohydrate, and fat. So it's 20 protein, 50 carb, 30 fats. And that study done over 5 months showed a decrease in depression, fatigue, and general stiffness. So that one got into the joints a little bit. So if you look at all these diets, the Mediterranean, the hypocaloric, working on those macronutrients, and some of the other dietary situations here, you're really seeing that, certainly a healthier diet makes a big difference for this condition. So some of the other things, so that's diet. Let's get into sleep hygiene. One of the things that I've talked about many times is how important it is to sleep. And I really believe this condition is rooted or seriously connected with starting out as a sleep disorder. So sleep hygiene, you can look that up. Basically it's just good sleeping habits. And a lot of people break these rules all the time, just getting bad habits about when to go to bed and how to settle down. And first off, no exercise before bed. So you want to separate exercise by at least 4 hours to let the body sort of calm down, let the body sort of change into that, go from performance, that sympathetic, parasympathetic axis, that problem between, turning on the performance side and letting the healing side start. You want to wind down in a sense, right? So you want to get off of any kind of high aerobic, intense powerlifting, kind of thing. 4 hours, let some time go by, let the body settle. Going for a walk after dinner, that's fine. That's really not an exercise that's going to really wake you up and stimulate you too much, but any intense exercise for sure. No electronics before bed. A lot of us know about the blue light coming out of our phones and our computers. Want to make sure that we're not stimulating that pineal gland, that in a sense, the third eye that wakes up and is stimulated by certain wavelengths of light, because that can keep us awake and disturb our sleep time. Caffeine and sugar, right? Stimulants, things that cause multiple ways of the body getting pumped up before bedtime. It's just not good. Regular sleep times. I've preached before going to bed at 9, getting up at 5. I know it's insane. People laugh when I tell them that, but it is a really been shown to be the healthiest imaginable thing you can do. So in other words, get to bed as early as you can, get up relatively early. It kind of stinks to start that off, right? You're exhausted, you're yawning all day, but then your body will get in that rhythm. I personally don't believe there are night owls. I can get in a good fight with anybody with that one. I just think the night owl thing's silly. If you really look, we don't do well in the dark. Go in the forest without a flashlight. You're going to take 5 steps, you're going to land on your face. I mean, you can't see in the dark. Other animals can. We're not nocturnal. You want to see something, look at how a nocturnal animal gets around in the dark. It's pretty amazing. They can, take a photon of light and see what's going on. We can't do that. So we're not nocturnal, and that's, thousands and thousands and thousands of years of existence. We have learned that we're supposed to go to bed when it's dark out and stay away from the lions, tigers, and bears and whatever else is out there. And getting on that, making sure that the room is dark. Dark and cool is the best sleeping environment for most people. Fresh air. I like to air my room out before I go to bed, especially if it's that spring and fall, that beautiful air. nice, clean, fresh air. Indoor air is 5 times more polluted than outdoor air. So getting all the plastics and formaldehyde and toluene, all the stuff coming out of your furniture and your electronics, polluting that room, breathing that in, it's bad for your hormones. And hormones are related to sleep, and every other wonderful thing that about being alive is related to hormones. So you want to make sure you clean all that air out if you can. I love air exchangers, heat exchangers. That's a whole other topic. Other thing is EMFs, right? The electrical impulses coming out of outlets. I think we had Michael Giamuso on a couple weeks back, and he got into how you can detect those. If you want to watch that podcast, go back to Michael Giamuso, naturopath. Wonderful guy, got into that with us. But yeah, EMFs, just electrical current. We're electrical beings. We really don't want to have electricity charging through our bodies while we're sleeping. We're trying to rejuvenate ourselves when we're half electrified. It's terrible. Also grounding the body. Talked about, laying on grounding mats or having a grounding wristband plugs into the ground outlet of your wall. Getting the static electricity out of your body is really, really great for inflammation and sleep and that kind of thing. And last but certainly not least, looking at the journaling your thoughts. A lot of people's minds are racing. That's why they're not sleeping. They're way too awake. And I like to write my thoughts down. Sometimes I actually make a list of things I'm going to do the next day. Because a thought will pop in my head while I'm trying to get to sleep. And I'm thinking, I better remember that. Well, trying to remember something is a form of tension. And that tension will keep you awake. So you write it down. You can say, okay, I can keep it's out of my head now. It's on paper. I'll look at that in the morning and then deal with that tomorrow and start that whole kind of concept that it's a fresh day tomorrow. I did what I could today. And when I couldn't get done, I wrote on this piece of paper for tomorrow. That's helped me a lot personally. It's a personal thing because I've had issues with falling asleep. I'm usually good once I get to sleep, but here and there in my life, I've had trouble falling asleep. So that's sleep hygiene. Exercise, they saw core stabilization exercise. I thought this was interesting because I still don't know why I couldn't find, but for some reason in research, they found that when you stabilize the core and do core exercises, maybe it's a stimulus to the gut, to massage the intestines like exercise can do. And you certainly don't want to do these right before bed. But stabilizing the core, planks, bridges, and the pelvic clock. If you lay on your back, knees bent, and you rock your pelvis in certain, you draw like a clock on your belly, and you rock your pelvis in the pelvic clock. That makes you use your stomach muscles and your pelvic really well. Great for lower back pain too, by the way. So planks, bridges, and the pelvic clock for core stabilization seems to get in there as well. And then let's look at therapies. Now, when we're looking at therapeutic interventions, we're talking about body work, for example. Now, yoga, as you may know, is one of my favorites. I think yoga is one of the most masterful things to get into your life. And yoga has been shown to deal fairly well with fibromyalgia. It's not the full picture. You can't have fibromyalgia, just do yoga and it goes away, because that's only that you're working with the physical emotion, but you're not working with the chemical side of fibromyalgia. And you want to work with all three with this condition, but you certainly should do it. Massage therapy, it's going to work blood into joints through muscle. It's a hypercirculator, breaking down some of the adhesions, creating better symmetry in the fascia of your body. All that helps you heal. And I think fibromyalgia is a breakdown exceeding repair disease. And that's why the sleep is so important. And the chemistry and the diet are so important. We want to speed that repair process up. And chiropractic care, of course, you want to make sure joints are aligned, that they're moving properly, which will then subsequently allow less nerve pressure syndromes to occur. I've got into this before. Nerve pressure, 10% of your nervous system senses pain. So if you have light pressure on a nerve, 10% of it will tell you it's pain. The rest of that nerve pressure is pretty silent, and it can cause other problems in other organ systems. A lot of research on this, pretty interesting over the years. The founder said this in 1895. Turns out he's right. And so we want to make sure that we're getting that as well. And last but not least, water intake, right? You got to make sure that you have enough hydration. And I like half your body weight in ounces. And if you're eating a lot of your water, meaning you're eating lots of fruits and vegetables, you need less water. And if you're into dairy products, alcohol, caffeine, and a lot of grains, you're going to have a lot of dehydration in your body. You have thicker blood. The viscosity of the speed and ease at which blood moves through your body is crucial to your general health. It's crucial to how your immune system works. So you want a strong immune system, because some of these conditions also are associated with immune disorders, like we were talking earlier. It's not considered an autoimmune disease, but it's related to a diminishing of your immune responses, which these days right now are extremely important. Okay, so that's pretty much fibromyalgia in a nutshell. It's a big condition. There's lots to know. You can look this stuff up but hopefully I was able to whet your appetite today and get you involved. If you like these podcasts, please give them a thumbs up. Anything to say, please put stuff in the comments. Any conditions you'd like to go over, books, that kind of stuff, let us know. I love covering different topics that interest people. So that's the latest in fibromyalgia, and we'll talk to you soon. Have a great day.